All right, welcome back. Let's get right back to it, Siobhan. We were talking a little bit before the break about stigmas on the industry. We'll get to that in a second, but we were also talking about opioids. You wanted to mention what it does to the brain.
So when someone takes either an opiate pill, an opioid pill, or an opiate such as heroin or any of that class of drugs, right? What it does is it signals the brain to change in a way that it no longer makes what it would naturally make to deal with pain. What's interesting is that the brain doesn't make a distinction between I broke my toe and my girlfriend broke up with me, right? Pain is pain is pain. And so stress is a form of pain. And so one of the things that happens is that people who have been using opioids, right? They've now shut off their system in their brain that deals with all of those stress issues and pain issues. And so when you remove the opioids, when they try to stop, it's almost impossible because the brain is screaming, everything hurts. Why aren't you helping me? You know, the whole body hurts, everything hurts. And the brain no longer, you know, it needs time to heal and to be able to manufacture those substances that are natural, that are going to help you manage stress, you know, be resilient, navigate your day, and deal with the painful events that come with life. I think that's one of the greatest reasons why long term, you know, going, even if you go to residential, why interacting or being in some part of therapeutic environment, whether it's support groups or outpatient, for a period of time afterward. Remember, we started with recovery as a long-term process. Part of that is just the healing that needs to happen, you know, in the brain and the body, you know, much less the spirit.
All right. Okay, so maybe if you're just joining us right now, kind of want to bring it all back to the beginning. Yeah. We are talking about if you, maybe someone you know, is dealing with any sort of addiction or mental illness, just know that there is help in folks like Foundations Recovery Network. And this is Siobhan. She is the Division Director of Clinical Services. We talked a little bit about your job title. Siobhan, how long have you been in this type of industry?
Oh, 12 years.
12 years?
Yes.
You know, what really keeps you coming back to, you know, you're very passionate about this topic tonight. We can obviously tell. We discussed before the show tonight. You said, if I can just help one person tonight, that's what it's all about.
Right.
Tell us about why that is.
It's just close to my heart. The powerlessness, the helplessness, the hopelessness, the fear, the shame that goes with having a substance use disorder, knowing that everything's a lie. Having to hide behind a pill, a bottle, you know, a baggie. That's not life. That's not living a life that one loves. That's not empowerment. That's not feeling, you know, that's not the point. That's not the purpose. And so for me, I just, I want to help people. I want people to know that that it is possible, that change is possible, that anyone can get better, anyone can recover, and that, you know, you're not alone. You know,
obviously, there are going to be some stigmas on the industry. Let's talk about that.
So there have been some, you know, I don't know, in other words, smarmy players, right? Unfortunately. So the addiction treatment has kind of lived in this weird space, somewhere between like healthcare and like a spa. You know what I mean? And so there wasn't a really good job of regulatory management, you know, until more recently. It's been getting a lot better. And so there have been some states that have had some unfortunate players, you know, that have gotten in some trouble. Proud to say, you know, Foundations Recovery Network has never been involved in anything like that. We have our research and outcomes program, which we talked about, which meets federal standards. You know, we are Joint Commission accredited as a healthcare organization. And I think, again, we were talking earlier about some of the things you want to look for. Definitely look for accredited organizations as well. But a lot of people, it's left a bad taste in some people's mouth about the industry. And so what I would encourage is do your homework. you know, look at websites, make the phone calls. There is a lot of information out there, but dig to that second level. You know, when someone tells you they provide integrated treatment, ask them, so what does that actually look like? What does that mean? Do you have a doctor that shows up every day? You know, do you have therapists who deal with both the mental health and the substance use disorder at the same time in the same treatment plan for my loved one? You know, ask questions. There's no bad questions.
I mean, when it comes to your health, whether mental, physical,
Absolutely.
It's worth that extra step of digging for information. Well, let's go ahead and take another call here. I believe we have Kathy on line 1. Hi, Kathy. What's your question tonight? Thanks for calling.
Well, what it is, it's my son is incarcerated. And the reason he is incarcerated is because of his actions when he's on meth and ice. I've never seen anything like this before. I have been around everything, every kind of addiction, and I have never seen anything like this before. And the judge has okayed him a furlough to be able to go to a treatment center.
Okay, good.
But can't get him in one. They've sent him 4 applications. He don't have insurance.
Okay.
So,
oh, sorry. Yeah, so obviously I think the question there, didn't mean to cut you off there, obviously the question is, you know, matter of insurance and affordability. And yeah, thank you so much for the call, Kathy. Obviously that is, you know, a concern that hits close to home. It's your child, you're trying to get them help, but where can you go when there's a matter of insurance?
So first, Kathy, great job. Hang in there, don't give up. Stay with your son. Thank you for doing that. It's not easy. And there are state funded facilities that will take direct from incarceration. Sometimes there's just waiting lists. So what I would do, Kathy, is continue to advocate, continue to call the social workers at wherever your son's incarcerated, continue to reach out to the judge. Just don't give up. Keep doing that. Get him on a waiting list. And the more that he speaks to the social worker at the jail or the prison as well, saying, I really want to do this, and the more he's committed, that's going to be really helpful as well. But this is evidence of something really sad that's going on in America. We're warehousing people with a disease.
You know, that brings me to my next question. Why is there such an epidemic now with addiction?
Oh boy. Okay, so probably the opiate use disorder brought everything, epidemic is what's brought everything to light. So there was a number of factors, social, cultural factors that all sort of conspired at the same time, which included the willingness of there was a long period of time where the medical industry did not want to address pain using something like morphine, using a narcotic. It became, so the pendulum was way to one side. What a group of young doctors, these young Turks who really wanted to make a difference and help, you know, in the late 70s, and so we're like, why are we not treating breakthrough cancer pain with these drugs that we have? And so the pendulum started to swing. We then, you know, because Americans are so brilliant, developed so many new formulations and new opioids that were able to address this, and pain became a really big criteria. And so when you go to the hospital, they always ask, right, how did we manage your pain, right? And so we became very focused on that. And unfortunately, as Americans, we're very consumer oriented, like, can I take a pill and will it get better? And so the pendulum swung really far to the other side. And so that in combination with just some really opportunistic heroin factories and farms, you know, entrepreneurs, have created the setting for what we are experiencing right now. You know, moving forward, probably some of the biggest things that we can do, just in general, is to become responsible for our health.
You know, it's a great way to break all that down for us. There's a lot to this. We're going to take a quick break here in just 1 minute, but before we go to break, I want to pop up that screen one more time where it has the number to the Foundation's Recovery Network, just in case you're watching tonight's show. Everything Siobhan has told us is absolutely wonderful and helpful, and you've taken so many calls tonight and really helped folks. We appreciate you being here this evening on OpenLine, and that's what it is, OpenLine. So if you still have a chance, we're not quite done with our show yet, you can call in after this next break, but we will be right back, so keep it right here.